So now it's time to bring on our other guests. This hour features Merrimack Valley nonprofits, and joining me are Nicole Ennis of the Front Door Agency, Lisa Britt-Solsky of Granite State Independent Living, and Anne-Marie French of the New Hampshire Fiscal Policy Institute. I'm Michelle Talwani, and I am the Director of Community Relations at the New Hampshire Community Loan Fund. We're a nonprofit that provides lending where traditional lending institutions are not able. Our focus is to help people of low to moderate incomes with affordable housing, childcare, nonprofits, and small businesses who typically hire people without a four-year college degree. Money raised for through New Hampshire Gives today will be used for the customized coaching and technical assistance we provide to our borrowers. And we actually do have a match this morning of $5,000. So we're excited about that and really grateful to our donors for putting up a match. And now, Nicole, can you tell us a little bit about yourself?
Sure. Good morning, everyone. My name is Nicole Ennis. I am the Chief Development Officer at the Front Door Agency. We are a local nonprofit serving the greater Nashua area, and we invest in individuals and families as they transition from crisis to self-sufficiency. We offer a hand-up opportunity to any of our clients to help them prevent homelessness. And we do that through a few different programs, one being our housing stability program that's open to any individual and family that may need some assistance, whether it be back rent, help with utilities, security deposit loan. With the high cost of rent right now, it's really difficult for a lot of our clients, especially with COVID-19. Another program which is more popular is our transformational housing program, which helps single mothers and their children as they transition from crisis, which could be of any certain kind, whether it be addiction, whether it be abuse. We have a three-phase transformational housing program where women really focus on education. We feel that education is what breaks the cycle of poverty. We can offer them affordable rent. We can offer them services, but until they get to that next level of education, they can't break that cycle of poverty. So we're excited to participate in New Hampshire Gives, and the funds that we receive will help directly support the women in our program and our transformational housing program with utilities, with their basic needs, transportation for them and their children, educational opportunity, and extensive case management to help them get through the phases and ultimately flourish in our program.
Well, Nicole, a very holistic approach to helping people. That sounds wonderful.
Thank you, Michelle.
You're welcome. Lisa Britt, tell us a little bit about yourself and the organization you're representing.
Good morning, everyone. As Michelle said, I'm Lisa Britt-Solsky. I'm the Vice President of Strategy and Corporate Development at Granite State Independent Living. GSIL, as all of us in the know refer to us, we are the statewide independent living center. We support people that experience disabilities in every aspect of their life. We run 20 different services and programs that empower and enable people with disabilities to live independently on their own terms in community. So among the portfolio of services are in-home personal care services. So this is just help getting people up and out the door in the morning and then getting home, getting fed, and going to bed every day. Things that I think a lot of us take for granted, frankly. But that is the lifeblood of the organization. We also do a lot of work in home modifications. So anything to make your house accessible given your particular disability. So anything from grab bars to changing out all of the doorknobs to be louvers instead of twisty knobs. We widen doorways so that people can move through with their wheelchairs more easily. And we do ramps inside and out, right? Because you got to be able to get in the house to experience the full independent living. We do transportation, so wheelchair accessible transportation for all aspects of whether it's shopping, getting to work, getting to social events. We do educational programs and job access. Again, everything is designed to help a person with disabilities overcome whatever barriers are preventing them from living as fulfilling and independent a life that everybody else is enjoying. We do have a match from our generous board of directors, and I am delighted to say we met our match at about 10 o'clock last night. So, yay! And proceeds today, I hope, will go towards really leaning into our biggest challenge right now, which is workforce. I know everybody is talking about that, but like I said at the top, the lifeblood of our organization is the tireless staff that go into people's homes every day to help them with all of that personal care so that they can be independent and live life on their own terms. So we need to hire a lot more people like everybody else. So I'm hoping we can really lean in on retention and recruitment.
Thank you, Lisa Britt. What really strikes me about what you said was that it's soup to nuts of what you offer, but in such a respectful way that clients get to choose how and what kind of services they want and need. So kudos to Granite State Independent Living for that approach. And now I would like Anne Marie to tell us a little bit about herself and the work that she does.
Yes, thank you, Michelle. Good morning. I'm Anne Marie French. I'm Executive Director of the New Hampshire Fiscal Policy Institute. NHFBI is an independent, nonprofit, nonpartisan policy research organization based in Concord. We're dedicated to exploring, developing, and promoting public policies that foster economic opportunity and prosperity for all New Hampshire residents, with a focus on low and moderate income families and individuals, and on the state's most vulnerable residents. Much of NHFBI's work centers on the state budget, on the revenue system that supports public services and meets public needs, and on public policies that are aimed at improving the health and well-being of New Hampshire residents. NHFBI produces regular reports on the fiscal and economic challenges facing the state, and we serve as a resource for other nonprofit organizations, for policymakers, for media, other government organizations, all looking to understand and improve public policy in the state. During the last year, we focused extensively on the health and economic impacts related to the COVID-19 crisis. NHFBI's data-driven research and analysis aids policymakers and the public in understanding the effects of the crisis on New Hampshire residents. You'll find all of our resources and publications at our website at nhfbi.org. Mm-hmm. This health and economic crisis has clearly and disproportionately impacted those with the fewest resources and opportunities. Individuals and families with lower and modest incomes, people with underlying health conditions and disabilities, and certain racial and ethnic groups have historically been disadvantaged and remain underserved. These factors contribute to higher total health and economic risks for these Granite Staters. And it's important to recognize that many Granite Staters were already struggling before the COVID-19 crisis began. And at the onset and throughout the crisis, New Hampshire's nonprofit sector, which is so vital to delivery of health and social services in the state, really rose to the occasion in amazing ways. Here in New Hampshire, we have traditionally relied heavily on our nonprofit sector to provide services and supports to meet critical needs of low income and vulnerable populations, many of whom were disproportionately impacted by this crisis. Many of our nonprofits really depend on donations to support their vital work. And New Hampshire Gives really provides a platform, not just to celebrate their amazing work, but also to help them to raise those vital resources to continue to meet these needs. And as we try to understand how residents are faring economically in the state, it's important to remember that New Hampshire's top-line numbers mask the reality for many Granite Staters. While New Hampshire has a relatively low overall statewide poverty rate, the poverty rates within New Hampshire are much higher for populations of color and for families with young children, particularly so for single-parent households with children. In fact, the most recent data from before the crisis, poverty levels were substantially elevated for single female-headed families in particular. Notably, about 1 in 3 families headed by a single woman with children under 5 lived in poverty in New Hampshire prior to the pandemic. But the poverty rate does not capture the complete picture either. So many families and residents struggle with limited incomes. They struggle to afford basic household expenses. In fact, prior to the pandemic, 1 in 5 households in New Hampshire had only $35,000 a year in annual income. So the effects of this crisis were very challenging for them, and they had limited savings for a rainy day. Housing costs, in particular, are a major challenge for Granite Staters, as Nicole mentioned. And in fact, the most recent estimates show that nearly half of renters in the state pay more than 30% of their income on housing, rent, and utilities. This leaves the households with very limited for other things and increases the risk of housing instability and homelessness. The crisis also demonstrated the important role that home and community-based care services provide for our ability to meet the needs of people in their homes. And prior to this crisis, New Hampshire was already struggling with workforce challenges, struggling to meet the needs of residents due to this shortage. And the crisis really highlighted the importance of enabling people to stay in their homes safely and for us to be able to meet their needs in that way. So this New Hampshire Gives event will support NHFPI's research and analysis in these and other areas to provide facts and information that will contribute to efforts to address critical issues and to help ensure New Hampshire uses its available resources to foster an equitable, inclusive, and sustainable economy.
Wow, Anne-Marie, that was a lot to digest, but great information. Your organization does such amazing work that many of us actually utilize when we do our own advocacy or fundraising, and lots of conferences that we go to use the data that you provide. So thank you for that, and I think you did a fantastic job sort of queuing up our next segment, which I'm looking at the time. I just want to make sure that maybe over the next like a 60-second story, Lisa Britt. I know that community and home-based care is really important to you, but if you could give us a quick story about Granite State Independent Living.
Sure. Thanks, Michelle. So as Anne-Marie said, it came into sharp relief over the course of the pandemic just how critical home and community-based care is. And that's because New Hampshire, regrettably, was #1 in the country for fatalities from COVID in nursing facilities. For consumers at GSIL, if we cannot provide the wraparound services that they need in their home, their only other option is a nursing facility. And what we know from 20 years of trying to rebalance long-term care is that people prefer to be at home. It is more cost effective for the payers for people to be at home. And now we have sort of a third leg of that stool, that it is phenomenally safer in a pandemic to be at home. So while New Hampshire had, almost 1,500, I think, fatalities writ large, most of which were in nursing facilities, at Granite State Independent Living, we serve hundreds of people in their homes with hundreds of other people as their caregivers. We had fewer than 20 consumers and staff combined come down with COVID, and we had 0 fatalities. Wow. So, this is an incredible time to invest in a more cost-effective service delivery model that provides people with independence and health integrity.
Thank you, Lisa Britt. That is amazing, those numbers and lives really saved by being able to be home and cared for there. Nicole, give us a little story about the Front Door Agency.
Sure. So I just want to mimic what Anne-Marie said, that many of our individuals and families that we serve were struggling prior to the pandemic. So the nonprofits really had to rise to the occasion to support all these people in our community. And I'm just going to share a quick story about one of the single mothers in our transformational housing program who has since graduated through the pandemic. But Sarah came to us about 1.5 years ago, a single mother who had struggled with addiction and actually made the decision to leave an unhealthy relationship. She had never lived on her own, didn't know what to do, hadn't graduated from high school, and she had twin 8-year-olds. She came into our program. She said she crossed her fingers and hoped she'd be accepted into the program, but she made quick positive changes to help herself and her children. Got her GED, and she actually, like I said, our focus is education. She went to school to get her certification to be a certified recovery support worker. She wanted to give back to people that had helped her. Received her certification. She took advantage of every opportunity, financial literacy classes, camp for her kids, childcare opportunities, and really, really excelled in the program. She's since graduated and is living on her own. She says she pays all her bills on time, sometimes early, but never late. I was really proud to hear her say that. And she just recently started a job about 3 months ago at a local hospital, and she is a certified recovery support worker. She's actually on the streets going out and helping people that are struggling with addiction. And I just think it's an amazing story of how she was able to come full circle, and she really just needed that hand up. She needed someone to give her that confidence and make those positive changes, and we're just super proud of her.
Well, the work that you do at the Front Door Agency is really impactful. Really appreciate you sharing that story, Nicole. And at the New Hampshire Community Loan Fund, part of our work is really normalizing good, safe manufactured home loans that otherwise are hard to get on the conventional banking system. We offer technical assistance and coaching to buyers through the entire mortgage process. We help to normalize homeownership for hardworking people in the state who can't afford the cost of a $360,000 home, but can afford a brand new manufactured home at $70,000. A recent home buyer who works in the medical field and who is a longtime renter just purchased a brand new 2-bedroom, 1-bath manufactured home in one of our resident-owned manufactured housing communities. She sent us a thank you note that said the day they were able to close on their loan was the best day of their lives outside of their marriage. So really helping to connect those with low to moderate income to home ownership to build wealth for them is really important for us. In all of our lending programs, whether it's to childcare centers, nonprofits, small businesses, to resident-owned communities who want to buy the land underneath their manufactured home, or to our single-family manufactured housing loan program, we offer customized coaching and technical assistance to guide people through the process and then beyond when they get the loan if they need it. And that's what we're raising money for through New Hampshire Gives. So that's a little bit about each of our organizations. I thank you all so much for participating with me today, and appreciate Tana Clues for coming on and telling us about the match for women and girls in the state. Very appreciative to the New Hampshire Center for Nonprofits, the New Hampshire Charitable Foundation and their donors, and all the donors across the state who have participated in New Hampshire Gives thus far. I saw the ticker just a minute ago, and we were over $2.1 million. So, and when we started this conversation, woo, right, LB? When we started this conversation, it was just had reached the $2 million mark. So we have more to come. People can give all day long, I think until 5 o'clock. And then I think we have some great clips from some more organizations to show. So thank you so much. Keep donating. We have a great, strong nonprofit sector in New Hampshire. Go on to newhampshiregives.org, find the organization that fits what you want to support, and I'm sure they'll be super appreciative. I know from the New Hampshire Community Loan Fund, we appreciate our donors and supporters as well. Thank you.